we've got to do a better job. We've got to teach our young women to examine their breasts. We've got to get to the doctor and let the doctors examine us and get our mammograms, because mammograms do make a difference.
I guess a lot of them are speaking doctors, so I know I should go to even though they're president.
Exactly.
Because those mammograms, they can hurt.
They can
flatten you down and cause so much pain.
Yes.
But the flatter they take you down, they kind of the better.
Exactly. Exactly. And what I tell women to do is, if you're a woman that has painful breasts anyway, and if you have those cysts in your breasts are probably more painful. And I say take a pain reliever, anything over the counter, Tylenol, Advil, or any of those, so that it'd be a little bit more comfortable. But it's so important to go and get it.
Why do they tell you not to take calcium from the December before?
No, I haven't heard of that recommendation. Now, I've heard that they tell you not to wear deodorant when you go to get your mammogram. And that's because deodorants have metals in them. And those metals can show up on the mammogram as something abnormal. So there's a myth out there that women will say, well, does deodorant cause cancer? It does not. And I'm sure your neighbor would be happy that you're wearing your deodorant. Especially if you work in close quarters and your husband. But it's just important that we want the clearest picture that we can, and we don't want anything to confuse the picture.
Okay. But, I mean, well, why did they have really hard?
Yeah.
Did they examine them beyond that? Maybe even ask that question.
Well, the breast tissue actually runs underneath the arm. So there is breast tissue right under the arm. So that's...
Is that going up to the shoulder?
It does. It goes all the way up to the collarbone. It goes to the top of the abdomen. It goes to the side here and over to the midline here, is where all of that is breast tissue.
And so that's where you got it so bad.
Yeah, so we try not to hurt you, but...
What age should a woman have a first mammogram?
Well, a woman that does not have a family history, should start at age 35. Should get her first, what we call baseline mammogram. If that mammogram is fine, then she's good for 5 years, and then starting at age 40, she should get a mammogram at least once a year. Yes. Now, if there's a woman that has a family history, so we'll say that mom or grandma was 42 when she was diagnosed with breast cancer, then the women in her family need to start 10 years earlier. So by age 30, age 32, the women in her family need to start getting their mammograms yearly.
Okay. Repeat that one more time.
Yes.
For you so they can hear it.
So no family history.
No family history.
Start at age 35.
Start at age 35.
And if that is clear, then at age 40, you get yearly mammograms.
Once a year after that.
Once a year after that. And some women may have to get it twice a year, and that's okay.
Why is that?
Because there's some women that have what we call dense breasts, or some women that don't have a family history but may be a high risk. And so we may need to study their breasts a little more often every 6 months.
What's dense tissue?
Dense tissue just means that you have good breast tissue. And what happens is on the mammogram, it'll look white on the mammogram.
Oh, okay.
So having dense breasts is not a bad thing. It just means you're still probably up and perky. As we start to get older, that density, the whiteness starts to be replaced by fat, and that's when we all start to do the Texas sag.
When you think breast implants dangerous?
They're not dangerous. They've actually gone back to using silicone. They're also saline implants. They are very safe now. They've reformulated them. For women that have silicone implants, we usually recommend that they get MRIs to evaluate their breasts every year.
What's the difference in an MRI?
An MRI is going to look at the breast tissue a little differently. Now, a lot of women will come and ask, can I get an MRI instead of getting a mammogram? We usually still want a mammogram first, and only in unique cases will we get an MRI. An MRI is a very good test, very sensitive. It shows us a lot of things, but it's almost too good in that it may show you too many things, and then the question is, what do you do about all those things that you see? And so that's why mammograms are only ordered in special cases.
What else could they show you that other than breast cancer?
They can show you some benign lesions. It can show you very, very early breast cancerous lesions. Yes. But it's a very expensive test. It's very time-consuming for the radiologist. They get something like 900 to 1,000 images that they have to look through. So it's not something we want everyone to be getting, because we want our radiologists, we want their eyes to be strong.
So mammogram alone is fine?
Yes, mammogram, and sometimes we'll use an ultrasound to go along with the mammogram.
Okay. Where is your practice located? How can I hear it?
My practice is located in Greenbelt, and I understand there's information at the end of the show.
Yes. One will be able to find you.
Yes.
Let's get to the guys for one thing. I have talked to some who haven't admitted it, but they will feel like a lump or thickening, and they do have breast cancer. My own husband has some of this, but he refuses to go to the doctor because there's nothing wrong with him.
Men can have a condition that's called gynecomastia, which means that they can just have extra breast tissue, and it can, look a little lumpy as our breasts can look. The one good thing about male breast cancer is it's very treatable. They get the same type of treatment. They can get a mastectomy, even though they have less breast tissue.
Really?
The good thing is that male breast cancers are very, what we call hormone responsive, so a lot of the medications work very well for them, and they do very well if they come in and get evaluated and we can detect them early.
Let's talk about HIV. Is that serious? Everybody I talk to, I get a different thing.
Yes.
I get a different thing.
Yes. The current thinking is that a woman should not be on hormone replacement for more than 5 years.
Okay.
Hormone replacement can put you at a slight increased risk for breast cancer. However, if you stop them after 5 years, your risk will eventually go back down to the risk that's in the general population.
Really?
Yes. So we advocate take it for 5 years, less than that if you can. But we want to at least try to decrease the risk as much as possible.
I wonder why the doctors try to cover all of this up. Don't come out on television. Don't take a whole lot of vitamin D. Or you have been maybe a week. Take all the vitamin D you want. The hormone replacement therapy can do cancer. No, 2 weeks now. Oh, it's fine. You can use it. You can ask your gynecologist. It's fine. Don't worry about it. I know people who've been on it for 20 and 25 years.
Yeah. Well, the interesting thing about medicine is it's not an exact science.
That's right.
And there's always new research, and there's always someone trying to answer a new question, and so that's why.
Why come out and get us all upset?
Yeah.
Because everybody talks about it.
Right.
At the gym today, when I was up there the other day, they knew I was going to do the show today. So they said, please ask her. Tell her to tell you the truth. So they can give you cancer, HRT.
Yes, they can, especially if you're on them for long periods of time. Yes, there can be an increased risk.
And do you have women that you've worked with that have gone through this as well?
I do. And they're still very treatable. Again, if you're getting your mammogram on a regular basis, we're able to find most cancers. Yes.
What do you think about the foods that we eat? They cause breast cancer. I know you're not a doctor in the field, but you are a woman to woman. What do you think?
Right. Well, I know the recommendation is that low-fat diet, watching what you eat. It has been shown that vitamin D can be protective, and vitamin D is very simple to get if you go out in the sunlight for about 15 minutes a day.
I take about 400 milligrams of vitamin D.
Yeah.
I've never had a tan in my life.
Yeah. Well, it has been shown that we do know that in African American patients, vitamin D levels are low, and it's because of the melanin in our skin, and we're not getting enough vitamin D from the sunlight. But taking supplements works as well.
I've always thought sun can cause cancer.
Well, it can, but that's why they say 15 minutes a day. Now, you don't want to go out there baking and be out there for hours at a time.
But 15 minutes in the yard every day for 15 minutes.
Yes, because your skin actually makes vitamin D.
It does?
It does. Yes, it does. So a little bit of sunlight is a good thing.
Okay, what about some of the foods? I know we shouldn't eat a lot of red meat. That's something that will cause cancer. Breast cancer.
It does. It's been shown to cause colon cancer, and it's it's one of those things where. Every time you look, as you were saying, they're telling you eat this and not that. And so I think just trying to eat in moderation, trying to get your 5 fruits and vegetables a day.
What do you eat?
I try to get in at least.
Chicken and fish.
Yes, I'm a chicken and fish person.
Me too.
I do like red meat. I try not to eat it a lot. I try and do exercise when I can. I'm trying to increase the amount of vegetables. I try and do whole wheat. So I just try and do the best that I can. I try and limit sweets when I can. I treat myself every now and then. But
dark chocolate.
I have. Oh, great.
You can be.
Yeah.
So I can go through that.
Yes. Yeah. What's interesting about chocolate and breast disease is these women that have the fibrocystic changes in the breast. The chocolate can cause the cyst to be reactive, meaning the breast can be more painful. The breast can be more cystic.